Jeff Braccini's house is an oasis in the dry Nevada heat, his family's paradise. But peace has not come easily for Jeff and his family. He lives here with wife Debbie and his two sons, Justin and Jeremy. 8 years ago, Jeremy was diagnosed with leukemia, part of a cancer cluster in Fallon of unknown origin. There's arsenic in the water, too much of it, and there's a local jet fuel plant. Still, there are no answers, but Jeff has been a determined activist for change in his community.
Literally had water, free water to put in the schools, and the school board denied it.
RN Roadshow activists Angel Kennedy and Donna Smith stopped in Fallon to talk to Jeff about his experience with health care.
My son Jeremy was diagnosed with acute lymphoblastic leukemia in 2001. He was part of a cluster of cancer that hit this community really hard. 17 kids in a very short span. We don't know why. We're still looking why. We lost three of our kids, and hopefully something never wanes from our memory that we did lose 3 kids. I was very fortunate that I buy into the military TRICARE system. Without that, it would have wiped us out. I have a company insurance policy. I was working, retired military at the time. The company insurance policy would have sealed off at $1 million, and that $1 million is about a year and a half's worth of treatment. We were a little over $2 million to get my son alive. I wouldn't know what to do if it wasn't for my health care. Probably 75–80% of the families had financial issues. And you don't, when you're looking at this impact, it's just not, you're looking at, okay, I got to pay my medical bills, but the financial impact of loss of wages, it's terrible. I mean, the costs have gotten so skyrocketed crazy. My kids' pills, one of my kids' pills were $235 a pill, but there's families that literally split up to pay for their health care. I mean, to get assistance, you can have nothing. I mean, nothing. You can't have a house. You can have a car. You have to be completely wiped clean to get any kind of a state or federal assistance. Something hit this town, so I became an advocate for my children. I became an advocate for not my kids, for everybody's kids, because someone has to speak out for children. They're our future, and if someone doesn't speak out and change things, then they can't speak out for themselves. Advocate at our level can do so much more, and it's extremely important that we all have. You're advocates, and it's important that you are advocates because we change things. The PhDs where I deal with call us the lay people. We have more power than they do because we can speak from the heart and people listen. So it's important that we change things. It's time for change. I'm not one into a big government scenario, but the healthcare needs reform. The cost is outrageous. To see healthcare taxed in any way is wrong. We need to, if the government needs money, go somewhere else.
Can you perceive what this whole scenario might have felt like for you if you didn't have the money to get him care?
And if I didn't have the money to get my son care, I wouldn't be living in this house today. It would wipe me out because I would have given everything up to get my son cared. The burden on these families that were uninsured was tremendous, and nobody should have to bring their child home from a cancer ward, put them in a room, and the next day you have to take off and go try to find money to survive. Jeremy's cured. It's a five-year from your date of diagnosis, he's cured of this cancer. Now, if you look at some of the healthcare issues that I have in the future and I've asked his oncologist, and no one has the answer. So he's cured of this cancer in the oncologist view. But these children are now reaching, the earliest kids that have actually survived ALL are now in the 35s, 40-year-old, and they're coming down with other cancers. Is that a pre-existing condition? Is that something that we're going to have to look at? I mean, a pre-existing condition, if you lose one job next, is my son cancer going to consider it a pre-existing condition? I mean, it becomes an adult. Health care. So I look at it as his doctor says no. But then health care, I was fortunate that I had an advocate assigned by my insurance company during the high times. Now that we're no longer pounding UC Davis's door, I lost my advocate, and now I have issues with my health care all the time. Was this required? Now when I go over we still have to go over twice a year to see his oncologist for a follow-up. And every time I go over there's an issue with my insurance company because I lost my advocate. Is this necessary? You're going out of point service, and it's like, look at the history. This kid's been in this care at UC Davis for 8 years, but every time I'm fighting insurance companies now. And I can imagine, and I have good insurance. I can imagine people that don't have that kind of insurance.